Maybe it would be the $8.5 million in healthcare stocks that would do it. During his 2022 Senate race against the traitorous ogre John Fetterman, Dr. Oz was required to disclose his stock holdings. And instead of a Medicare option for all, which has a 70% approval rating in the US, Dr. Oz supports Medicare Advantage for all. While sounding similar, Medicare Advantage is the private option version of Medicare, covering the same things, except instead of the coverage being provided by the government, it's provided by companies like Humana and United Healthcare. In 2020, Dr. Oz wrote a think piece in Forbes suggesting that the answer to providing millions of Americans with universal healthcare is to have the government simply buy Medicare Advantage for everyone, for the low cost of a 20% payroll tax increase. While Medicare Advantage is rising in popularity as an option for seniors, there is serious concern about the private industry's tendency to deny coverage. On top of that, Medicare Advantage is cost ineffective. An audit by MedPAC shows that Medicare spends 22% more for Medicare Advantage patients, an estimated $83 billion more dollars for 2024, which conveniently matches the 20% increase Oz had suggested. Curiouser and curiouser.
Curiouser and curiouser.
What Dr. Oz fails to mention in his Forbes article advocating for Advantage is the over $500,000 he has invested specifically in United Health Group, not to mention the hundreds of thousands he has invested in other healthcare companies like CVS, Aetna, and HCA Healthcare. These investments prompted Elizabeth Warren to send a letter directly to Dr. Oz, pointing out the clear conflict of interest in his nomination, noting that his proposed Medicare Advantage for All plan would roughly double the revenue of United Healthcare to $274 billion. Warren and the 6 other Democrats who co-signed the letter, including the ranking member of the Finance Committee, Senator Ron Wyden, ripped Dr. Oz a new one so large, even he couldn't sew it back up. But they don't stop there. They end the letter demanding that Oz responds to a series of questions before his nomination even appears before the Senate, asking if he will continue to support his privatization of Medicare, despite it being more expensive. They ask if he will divest should he be confirmed, and what will he do about the unlawful denial of desperately needed healthcare. All in all, this may be the most egregious conflict of interest we've seen in a long time. I mean, it'd be like appointing an oil investor to be the head of the EPA, or a private school investor to be the head of the Department of Education. Oh, wait.
Looks like next year when Trump gets back in office, we're going to have another guy worth over $100 million running Medicare and Medicaid services for the American people. Medicare and Medicaid is made for the poor and the elderly who can't afford health care, so they can get free healthcare services or low-cost healthcare services. And this guy owns stock in many different healthcare and insurance companies, private healthcare and private insurance companies, such as United Healthcare. Everybody's heard about United Healthcare recently. They're not very popular right now. They're known for denying over 30% of insurance claims. So sick people are going to the doctor trying to get coverage, trying to get healthcare, and they're being denied by companies like United Healthcare. And Dr. Oz, who Donald Trump chose, he's a owner. He's a stock owner of United Healthcare. So what do you think he's going to do? You think he's going to want to help people get more healthcare, more free healthcare like Medicare and Medicaid? Or is he going to want them to buy private healthcare so he can make more money? Why would Trump choose this guy to run Medicare and Medicaid? Medicare and Medicaid are supposed to be free and affordable healthcare for the American people. Why are they doing this? Why are they trying to rip off Americans? They're going to try and take away Medicare, free Medicare for the poor, the needy, and the elderly, and charge them health care. This is ridiculous. This is crazy. This is why we need to create a free Medicare for all, so everybody can get health care, even the people who have money. That's the only way that it's going to work. If everybody is fairly treated and everybody can get the same health care, so everybody is treated equally.